The H3N8 virus, more commonly known as dog flu, is causing concerns for dog owners in 30 states, although Oklahoma veterinarian Doug Ruby points out so far there's only been one confirmed case in the state.
If they are one that goes to dog shows, high volume of animals in a small area, perhaps their risk is a little higher and you need to look for signs of the upper respiratory symptoms. Usually they'll manifest within 2 to 4 days after exposure, with maybe some sneezing and then some coughing.
Canine influenza is thought to have started in greyhounds, although it can affect any breed, large or small. Because it's a new virus, dogs have no immunity.
They think it may be similar to the humans if there's this change and mutation in the virus, that just because they get it once does not necessarily mean that they're then immune for life, as in other viruses they usually are. This may have enough drift in the virus that it can become reinfected in a couple years if it has mutated.
The death rate for canine influenza has been low, but some dogs develop a secondary pneumonia that can be life-threatening. Your dog's risk depends on its environment. Pets living in shelters or who are boarded in kennels are at the highest risk.
It's not the virus itself that is causing the severe form. In the majority of cases, it's a concomitant bacterial infection, and those are usually due to other extenuating circumstances. So the household pet, I certainly wouldn't be very fearful that we're at high risk.
There are no clinical signs that can distinguish canine influenza from other respiratory infections such as kennel cough. A dog suspected of having the illness should be swabbed and the sample sent to a diagnostic lab. Almost all dogs exposed to the disease will become infected. Most of those will improve on their own within 2 weeks. 20% of infected dogs will show no symptoms at all. All infected dogs should be isolated for 2 weeks, and owners and handlers should stay on alert.
When you see the symptoms, if it persists and it seems to be worsening, if you can go see your veterinarian, they can assess and see if there's any evidence of progression to pneumonia, usually fever, lethargy, maybe not wanting to eat. And they're looking for those signs, well then they definitely need to be seen as soon as possible.
A vaccine is also available that Dr. Ruby says may be beneficial to dogs at higher risks, such as those who live in shelters. Veterinarians also point out the disease is not contagious to humans. In Oklahoma City, Lori Rasmussen, the Oklahoma News Report.